Good afternoon, everyone. I'm pleased that you're able to spend time with us this afternoon to participate in this webinar, Building Healthy Communities Through Improved Health Literacy. I've listed the speakers here. I'll go ahead and introduce them more formally in a moment. But before I do, I'd like to go ahead and just mention a couple housekeeping comments. We are recording the program and we'll be sending out a copy of the webinar within the next few days. Because of the background noise, we have everyone placed in a mute mode. We will use the chat box. If you have any questions, feel free to chat in the chat box. And if we have time at the end, we will answer those questions. And whatever questions we get that we can't get to, we'll provide written comments and send those out to everyone along with the recording. So before I introduce the program speakers, well, let me go ahead and start. Let me just get my screen to move here. There we go. I'm going to go ahead and introduce our three primary speakers today. My name is Tom Chamberlain. I'm founder and CEO of EdLogix, and I'll be serving as the moderator and speaker today. And we're very honored to have Tommy Thompson, the Honorable former Secretary of Health and Human Services and four-term governor of Wisconsin. He's also the chairman of EdLogix. And we'll also be hearing from Jim Spoor, who is president and CEO of Reinvent Hampton Roads, which is a very exciting organization that Jim Spoor took over as after he was city manager of Virginia Beach, the largest city in the state of Virginia. And I believe he was city manager for about 25 years. So Jim's going to be speaking to us and talking a little bit about Reinvent Hampton Roads and some of the exciting things that this area is doing in the southeastern part of Virginia. So I'll be turning the program over to our speakers as we move forward. And we have a couple surprise guest speakers that are going to be just coming in for a few minutes to give some perspective on their role and how they're supporting what we're calling Healthier Hampton Roads. So Healthier Hampton Roads is a community-wide collaboration to improve health literacy, workforce productivity, and economic prosperity in Hampton Roads. Hampton Roads is a multi-city region primarily made up of Virginia Beach and Norfolk and Portsmouth and Chesapeake and Newport News and Hampton and the Eastern Shore. So it's a very high growth area, a lot of military, but a lot of hospitality, and we're really moving into innovation in an area of health tech and becoming an innovation hub. So I'll talk a little bit more about Healthier Hampton Roads. We'll be expanding upon this and how we are planning for Healthier Hampton Roads, how we're launching it, and how we plan to expand that. But that's what we're going to be referencing is Healthier Hampton Roads, and we're excited. And before we go into what we're doing with Healthier Hampton Roads, I just wanted to address some key questions. And first of all, why build healthy communities? I think everyone on this call today is a supporter of why the importance of building healthy communities, why it's important to the entire economic region of that community, and some of the benefits. And we have national associations, foundations, and groups, insurance companies, and many of the healthcare organizations are really starting to expand beyond the walls. Even the employers are trying to build healthy communities. That's where their workforce comes from. So building a healthy community is really an important initiative and something that benefits everyone in that community, and primarily the citizens of that community. And why focus on health literacy? We think health literacy is absolutely a key fundamental asset that has to be addressed in building healthy communities. There's a lot of challenges in building healthy communities, and we think health literacy is where it starts. And the reason being is when you look at the definition of what is health literacy, and the formal definition is that the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. But if we kind of scratch that off and really look at what the lay term is health literacy means that you can find and understand the information you need to make good decisions about your health. And if you can't find or understand information about your health as an individual, it's a big challenge. It's a complicated area of health, and most people have lower health literacy than they need to really improve their health and their wellness. So when we look at health literacy, it's a multi-billion-dollar a year problem. up to $238 billion a year annually are attributed to low health literacy in the United States. And it's responsible for longer hospital stays, admissions into the ER, non-adherence to treatment plans. It's estimated that there's 90 million Americans that are at risk for preventable health problems because they have difficulty understanding health information. So there's a lot of data on this slide, but if we bring it down to an individual level, and this is data that came out of University of Connecticut in 2006, but health literacy at an individual level costs $8,000 per year more if a person has low health literacy compared to someone with high health literacy. So it's a very significant problem at an individual level and obviously at a community-wide level or an employer level or a health system level. So this is data that is becoming more relevant and more prevalent in the literature, and we're going to see more of that. Now, when you look at why Hampton Roads, why should we focus on Hampton Roads, or why are we focusing on Hampton Roads? We're looking at health literacy at a national level, and this is a pretty interesting heat map, and there's data that's out there looking at health literacy, and this map shows the entire U.S. region. You can see that the red areas, the hot zones with low health literacy around the country, and you can go down and use this health literacy map, and we'll be glad to share this URL with you when we send information out. But if you click on Virginia, so the state of Virginia, that's going to bring up a health literacy map and a capability for us to look at the state of Virginia. So we can look at the state of Virginia and find that there's pockets of low health literacy, but there's also a lot of good health literacy in Northern Virginia and parts of Southeastern Virginia. This is Hampton Roads right here. So even within those pockets, they show a lot of green, and in Northern Virginia, and you can be assured when Amazon was relocating, they were looking at the U.S. map in various cities, and they relocated to Northern Virginia. And one of those factors on their relocation was, what is the health literacy of the region, the workforce? It costs them a lot more with low health literacy, so people won't move to regions that have low health literacy as opposed to those regions that are relatively health literate. Now, when we look at these regions right here, let me go ahead and pick Norfolk, for example. Norfolk has some good health literacy and pockets of it, but right across in the zip codes right next to them, there's very low health literacy and marginal health literacy. So within a city, you have different zip codes. And in Boston, there's a 30-year gap in life expectancy in the Commons versus the Back Bay, and they're calling that the death gap, and they attribute that to health literacy. So health literacy is becoming a major issue in the business side of the equation. We're going to be talking about that in more detail as we go through this. So that's why we're focusing on Hampton Roads. Is, you know, we have a need in this marketplace. We look good on the national map, but it's also a reason why we're coming into Hampton Roads, and not just Hampton Roads, but in Nashville as well. And we're looking to create a national health literacy model. AdLogix is based in Virginia Beach. So we have relationships. We know the marketplace. We know the leaders. We know the various community stakeholders. And we have an advantage by being located here. So Hampton Roads, it was a natural because of the interest in the area of becoming an innovation hub, but also our physical location here. So we have people on the ground. And we, as you'll hear as we go through this, we've got tremendous resources that are coming to the table and are part of this major national or this major health literacy initiative. But we want to build a model that works in Hampton Roads. And we're also in the early stages of Nashville. So we're looking at Hampton Roads and Nashville as two models that we will build. They're different types of cities, but each model is going to be a little bit different. But if we can take that model and bring it to Charlotte and Pittsburgh and Atlanta and other regions, we think that that's going to be huge. The insurance industry is focusing on building those healthy communities so everyone wins, and they're just one of the stakeholders that has a strong interest in that. Now, when we look at why AdLogix is based here, I mentioned, but as a PharmD who used to take care of my own patients, I knew that health literacy was a major problem in achieving good health outcomes and reducing healthcare costs. I was treating my own patients, ordering my own drugs and labs, but I knew that health literacy didn't work. Giving them a pamphlet about diabetes or telling them how to measure their blood sugars wasn't really doing it. So I've always had in my mission, personal mission, is to build a solution that can address health literacy at an individual level. And you're going to see a little bit about the platform that we've invested heavily in and built. But we also are, an organization, and my background stems from years of various types of companies that I built in the past. One of them was the Benefit Design Institute. This was in 2006, and this is the cover of a white paper that we developed. And it was called Rethinking Benefit Design: Innovative Strategies for Preserving and Enhancing Health. And this was a program that brought industry leaders from all, from the employer markets, the insurance industry, the benefit consulting firms, and we brought them all into a central location, actually in Las Vegas. Tommy Thompson was the keynote speaker, and we published a white paper that went out, and there were 3 different print runs because it was so popular, but we distributed that around the nation, and we were a little bit ahead of ourselves. That the information that's in here, if you really look at the table of contents, we have understanding employer healthcare costs. Again, this is back in 2006, 13 years ago. Shifting the focus to prevention, human capital management, the importance of investing into your biggest asset, your people, and really helping them to understand through education their role in managing their health. And then we talk about data integration and avoiding the silo mentality. It needs to be a multifaceted, integrated solution. You can't have silos of people that are looking at their own budget. Those walls need to be broken down. And then we talked about the use of incentives, both sticks and carrots. And then consumer-driven healthcare, which was really just early on in the healthcare industry at that time. But we talked about all of this stuff, and in there was the foreword. The foreword to the Benefit Design Institute white paper was given by Tommy Thompson, and you can see on this foreword, this was just the top half of this white paper on his foreword. And I don't know if Tommy is in a location. He was running a little bit tight on time, but
no, Tom, I'm on and ready to go. I'm very excited, awesome. Tom. I'm very excited for being here. I'm very excited because you have worked so hard, Tom. You're indefatigable as far as trying to educate the American public about healthcare and how we can set up a better wellness system and really hold down on healthcare costs and improve the quality of health. That's been your mission. It's been my mission, and we've joined up since 2006 when I gave the speech out in Las Vegas for the Benefit Design Institute, and I thank you for your leadership in that effort, as well as your leadership in EdLogix, as well as Healthy Communities. As Tom has indicated, we had a wonderful rollout for a healthy community, and it was, and Jim, who's going to be a speaker later, was an outstanding speaker at that time and will be so again today. But our whole feeling is, Tom, myself, and the people that are involved in this, is trying to figure out how do we set up a real wellness system. When you look at the healthcare system in America, we're spending about 91, 92% of all the dollars, which is about $3 trillion, about 20% of the gross national product, and getting people healthy, get them well after they get sick. Now, to me, that, as a former secretary and as a governor, that seems a little bit strange. Why don't we spend some of that money in order to really get people healthy and keep them healthy? More of a wellness system instead of a sickness system, an illness system, which we have today. And Tom and I have been joined at the hip in trying to come up with ways to do that. EdLogix is the platform in which we can educate America and educate communities about how they can buy in, support, and help to build their own communities. We had this initiative, this rollout at Hampton Roads. And as Tom has said, we got it in Nashville and Hampton Roads, but I would like to see it nationally. I would like to see this model that we're talking about today rolled out across America so that we have it in Milwaukee, we have it in New York, we have it in Florida, we have it all over the country. No matter where you come from, you have people buying in to healthier communities, and also using the information analysis like EdLogic to help educate the American public. The Benefit Design Institute is set up, and it believes that payers, vendors, and policymakers must shift greater resources into preventative health. And that's always been my mantra. How do we get more people involved in wellness and prevention? Because we can improve the quality of health, therefore the quality of lives of our citizens, and hold down the costs of expenditures in the healthcare system that really don't accomplish nothing except get you well after you get sick. The strategies and the proven wellness programs are out there, and now we got to make sure that people are educated, and the platform that Tom has set up in EdLogic helps that a great deal. Individuals must take greater responsibility. We've all talked about that, but people know that about 72% of the cost in healthcare comes from chronic illnesses. And so if in fact, which can be self-prevented, a good share of it. And so if we learn how to make people healthier, and if we teach them through EdLogic and through healthy communities how to keep themselves healthy, we're going to make their lives better, make their families better, and make the quality of life so much better. So that is what we're trying to do, and that's what Hampton Roads Health Literacy Community Leadership Forum was all about. I was pleased in order to be a speaker at it at Old Dominion University, and they really held a great forum. We had a great reputation, and great number of people showed up, and it was an invitation only, but the crowd was excited. They were very much involved with what we were talking about, and we had a full house, and they stayed till the end. But here's our vision, and I'm going to leave with this vision because I really think that the vision sets forth what we all are trying to accomplish. A multi-stakeholder, which is you, all the people on this line, but also all the healthy communities. We can use Hampton Roads as a model and start exporting that model across America. So it's a multi-stakeholder, integrated, community-based program. And you got to have people buy into it like we do at Hampton Roads. And it bridges the work site and the community, and connecting Hampton Roads through an interactive digital health platform like EdLogic, which EdLogic is really setting up to do. It provides a vehicle for increasing our awareness, and that's what I've been talking about, making the citizens of our country more aware of their health care, and then allowing the communication systems that we have and we can use. Education, which is what EdLogic is all about, is educating you about diseases and how you prevent diabetes, which is a growing epidemic in our country, and how we can engage and allow for that behavior change. We all know it's there. We got to exercise. We got to stop smoking. We got to eat correctly. We got to get enough sleep. You know, it's not rocket science, but if all of us are working together, and with a platform like EdLogic, we got a chance, I think, to accomplish a great deal and get more of that 92% spend in getting you healthy after you're sick, keeping you healthy. And that's my objective. That's my goal. And I'm happy to say that's also Tom's. And I just would like to congratulate Tom and Jim, who's on this program, as well as the other people in the Hampton Roads Initiative that make it all possible. Thank you for giving me this opportunity, Tom.
Yeah, thank you very much, Tom. We really appreciate your leadership and everything you've done to participate and really stimulate a lot of exciting activities in Hampton Roads. So I'm going to go ahead and if you could mute on the background noise, that would be great. I'm going to continue on. So with Tommy's setup, we talked about the Health Literacy Forum. That was a second forum that we did. We had done one several months earlier than that with a smaller group. We had close to 100 people at the forum, but we've also built a board of advisors. So we have a Healthier Hampton Roads board of advisors that's made up of Tommy Thompson and Jim Spoor, who will be speaking shortly, Bonnie Van Loonen and Nancy Gurdon from Old Dominion University, and Jordan Asher from Centera Healthcare, a senior executive there, Gil Bland from the Urban League. Many of you in Hampton Roads know Gil. And then we have some business people like Russ Turner, and on the other side, Les Hall. Les Hall was the first client of EdLogic, started with us 5 years ago and has been on the platform ever since. Dr. Cynthia Burwell from Norfolk State, Amanda Jackson, and Stephanie Gorham will be speaking. I'll introduce them more formally in a few minutes. And then Candace Driscoll, who is the Executive Director of Access Partnerships. And then one of our partners in Nashville, Scott Massey from the Global Action Platform. So we have a board of advisors. We're developing working groups around the social and behavioral determinants of health for those underserved communities. And we're building other task force as well. So what I'd like to do is really quickly go through and talk about some of the first half of the vision that Tommy shared, which is the multi-stakeholder community-based programs that bridges the worksite and the community. And it takes a broad engagement of all stakeholders, and it needs to include the corporations. Obviously, the corporations are key to any community. So the large and small corporations. Town Bank is a very influential company in Hampton Roads. They have 2,500 employees. We've been with them for 3 years. We're implementing the Port of Virginia on November 1st. We're talking to Centera Healthcare, 28,000 employees, and a number of other employers in the region that want to be recognized as innovative leaders in this health literacy initiative. The municipalities play a key role, whether it be municipalities that, from the mayors down. We're meeting with the mayors. They should be coming on as an employer. The city of Virginia Beach has a $200 million spend as a self-insured employer. Healthier, more health literate people is important. But the public health departments, the public libraries, Amanda Jackson from the Chesapeake Library System is a good example. And then our community health centers and various Healthy Suffolk, Healthy Chesapeake, and groups like that. So the municipalities play a key role. The health systems in the community, I mentioned Centera Healthcare. They have 42% of the Medicaid population, followed by Anthem, but they're a major player. We have other hospital systems and Chesapeake Regional and Riverside and Bon Secours, different hospital systems, CHKD, Children's Hospital of King's Daughters, and then physician groups. So the health systems are playing a key role, and we're at different levels of discussions with them. But the community-based organizations is really where we started. And we needed to get the buy-in from organizations like Stephanie Gorham, who is the Executive Director of Volunteer Hampton Roads, and Candy Driscoll, who is Access Partnerships. But we're working with the United Way in Southampton Roads. You can see the list, faith-based organizations, the ADA and the American Heart Association. The Girls Club, the Boys and Girls Club and the YMCA are good ways to get the information, not only to the kids, but to the parents of those kids that are in these organizations. So we have a multi-pronged attack on getting the engagement that we need from these various community-based organizations. And they're buying in, and they're part of the viral information that's getting around the community and participating in the distribution of this as well as content. So I'm going to stop and pause for a second and introduce Amanda Jackson, who is the library director in the Chesapeake Public Library. So Amanda came to us through people within the city of Chesapeake. But Amanda, I'm going to turn that over to you, and you can share a little insight into why you're so excited about participating in Healthier Hampton Roads.
Great. Thank you so much. Yes, I'm so excited to be here today. I received the initial webinar on Healthier Hampton Roads from my boss, the Deputy City Manager, Dr. Wanda Bailey. And when I watched it, I knew this was something public libraries across the region should be involved in. People know libraries provide information, but few realize how valuable the library is when it comes to your health. We are a natural destination for individuals with questions or concerns about their health or the health of their loved ones. If they don't know where to go, but they know they need information, they come to their local library. We get information. We offer information in print, electronic databases with access to the most cutting-edge developments in health science programs and classes centered around health and wellness. And our staff are trained experts in research. All of this is completely free to the community. And what Healthier Hampton Roads provides is that partnership that leverages what we're already doing in libraries and creates visibility with a new market of library patrons. Libraries thrive in strong communities, and Healthier Hampton Roads seeks to strengthen our community through health literacy and information sharing. it's a natural partnership. And anytime somebody mentions the word literacy, my ears perk up. And just getting an opportunity to talk to you, Tom, and to talk about the things that you're doing and the things that Healthier Hampton Roads is going to do for our community, I just feel like this collaboration provides boundless opportunities for exploration and innovation. And I'm excited to be able to be a part of that.
Excellent. Well, we're real excited. And Amanda, there's 7 public libraries in the city of Chesapeake, but there's 50 libraries in the entire Hampton Roads region. And Amanda plays a key role in that network and has asked me to speak to all representatives of all 50 libraries on November 1st. So this library network is critical to have bricks and mortar. They have places where people can sign up, use their computers and their technology. They have educational rooms that we can convene people that are in the underserved communities. They use it for Wi-Fi. So they have phones, smartphones, but they need that free Wi-Fi. So there's so many ways that the library system can play a key role in improving health literacy throughout Hampton Roads. So thank you so much, Amanda.
Thank you.
I'd like to, I appreciate all your support. Stephanie Gorham had a conflict. She may be on. She is the Executive Director of Volunteer Hampton Roads. And Stephanie, if you're on, I'd love to turn it over to you. If not, then she had a touch and go day today with a client that needed some help. So I'm assuming that Stephanie is not on the call. She just emailed me just before this and had a conflict. But Stephanie is the Executive Director of Volunteer Hampton Roads and plays a key role in what we're doing. Volunteers are critical to this. There's healthcare professionals out there, nurse practitioners, retired people, physicians, healthcare professionals, non-healthcare professionals that are looking for things to do in the community. So we're matching up what we're doing in Hampton Roads with the volunteers that she has in her database. So tremendous asset. When the Virginia Beach shooting occurred, they mobilized 140 qualified mental health counselors through Stephanie's network to help people, with their struggles through the active shooting that took place, the horrific event. So that's an example of how the Volunteer Hampton Roads can play a role, and we think that they play a critical role in our initiative. And then also economic development groups, they play a key role. So economic development groups in Hampton Roads, just a selection of them, Reinvent Hampton Roads that Jim Spoor is going to be talking about. But the Hampton Roads Workforce Council with Sean Avery. I just set up a meeting with him this morning. They're a very powerful group, a newly formed group that's relatively newly formed, that is out there really enhancing the productivity of the workforce. And Hampton Roads Economic Development Alliance, or Go Virginia, which is tying Hampton Roads with the city of Richmond in that corridor. There's tremendous assets, resources, and capabilities that we can pull in. The Chamber of Commerce in Hampton Roads Chamber and the Peninsula Chamber play a key role. And then we also have entrepreneurial types of organizations that stimulate innovation through entrepreneurs and funding. 757 Angels and 757 Accelerate. 757 Angels was an initial funder of EdLogix. But the list goes on, the Rotaries and other groups. But I could talk about all of these in greater detail, but we're limited on time. So I'm going to continue moving forward. But the academic institutions are critical. The universities that are in your communities have to play a role, and they're looking for that opportunity. Unfortunately, Nancy Gurdon and Bonnie Van Loonen couldn't be with us today due to other conflicts, but I'll talk a little bit about both ODU and some of the other universities. And then also the private and public schools are critical to us. So the universities, Old Dominion University, I'll come back and talk a little bit more detail, but EVMS, Eastern Virginia Medical School, Norfolk State, these organizations, everyone's familiar with the College of William and Mary around the nation. I'm sure you've heard of William and Mary, but the smaller schools like Virginia Wesleyan University and Tidewater Community College, they all play a role and will all be part of the distribution channel and the beneficiary of the great things that we're going to be doing and talking a little bit more about. Public school and private school systems. Mansman Suffolk Academy is a private school system in Suffolk. They saw the platform. We went to the schools so that the kids could bring the information home to their parents, because health literacy is a family issue. And the behavior change that happens is at home. It's not at work necessarily. It's not in the schools, but at home. So But when they saw the platform, they thought it was a great platform for the freshmen, sophomores, juniors, and seniors. And so we're going to build a model in that upperclassmen area so that we can build a model and bring it out to the public schools. Cape Henry Collegiate is another one, but we want to talk to Norfolk Collegiate and all the others as well. So once we get a model for the student, we will then bring that out to the public schools, and eventually it's going to be K through 12. We're not there yet, but with funding, we're going to get to the kids. So Old Dominion University, just real quickly, they're a very active partner of ours. Critical role that they play from President Broderick all the way down to the deans and the provost. But they sponsored the Health Literacy Forum. Their College of Health Science and their Center for Global Health is a real champion of health literacy. We're looking at a center of excellence there. They were the ones that helped fund the initial ODU pilot program where they use our platform with their students. We're into the college campuses, we're into employers, and now we're going into the community. But their gamification, their game studies, and their library sciences, and their College of Arts and Letters, internships. We're forming internships that will play a role in this initiative, both in cybersecurity, in the School of Business, and the School of Nursing. And then the Economic Development Catalyst Task Force is a newly formed group that ODU is heading up to really accelerate innovation in the community. And so a number of initiatives that they're involved with, but the middle part of this vision is connecting Hampton Roads through an interactive digital platform. And that interactive digital platform and the consumer-facing URL will be Rewards for Healthy Living. And Rewards for Healthy Living is what people will go and access. They'll sign up with an email and a password. They'll get into the platform, and what can they do on that? They can play games, they compete with friends, they can watch videos, they can earn points and take quizzes. The more we know about them through their gameplay and through their quizzes, the more personalized the educational experience is. So it's data-driven personalization based on age, gender, their attributes, their preferences. But they have prizes. They can win cash and other prizes. So it's very incentive-driven. And hopefully I can just take a moment to go over that. But that platform is the vehicle, as Tommy said earlier, to increase awareness and communication and education, engagement, and behavior change. So that platform is written about by our clients. This is Allegheny County School System, talking about EdLogix, educating, entertaining, and rewarding. Now, this is going to be on recording, so if you want to go back and look at these, you can pause your recording and take a look at this. But that's the first publication that came out in Community Health Magazine. And that was followed by this one, which talked about game-based learning can boost health knowledge. So we think that we've got something pretty cool when our clients are publishing in trade journals and magazines on what we're doing. This is an example of a game called Fact or Myth, and it can be customized for anything in the community. The city of Norfolk has free mental health counseling services. Is that a fact or a myth? And you select it, and if you select it, you get 300 points, and you climb the leaderboard, and you get higher odds of winning cash and incentives and prizes. But the answer is fact, yes. Norfolk has a mental health counseling program available at no charge to Norfolk citizens. For more information, call this number. So we can have hundreds of questions about what's going on in Hampton Roads that is customized. And same thing with employers. We customize their employer vendors and teach the employees about all the resources they have available to them through this simple customized gameplay. And then 81%, we talk about behavior change, say they'll change their behavior based on the information that was presented. So we have very strong core satisfaction with people that are playing on the platform from our various users, whether they be employers, university students, or the general population. So real quick, I'm going to just go in here and just show you just for a second. We're tight on time, but I'm going to go ahead and just pull up the platform so you have an appreciation for what the platform looks like. And so this brings up a platform. It's my platform. It remembers where I am. Here is National Bosses Day. That just happened. You can go in here and give your job habits a checkup. So this is a notification that can be anything that we want. I can pull this up, and it's going to pull up a learning module around the benefits of healthy work habits. And so these healthy work habits, there's quizzes, there's an infographic, there's games that you can play, there's questions that we're asking and getting information. You can play these games, you can get frequently asked questions. There's videos and images about good healthy work habits. And then there's recipes and related hot topics. and those hot topics are significant. And then there's also related learning pages. So very comprehensive. And if we look at just real quick on the homepage, and there's a daily health scratch card that they can go in and play. And today's daily health scratch card, and there's a lottery that's going on in 8 days. What can prevent type 2 diabetes? If you're not sure the answer, you can go in here and you can learn more about type 2 diabetes. And so you can get your info. This is loaded with information. And then we know that it's going to be maintaining a healthy weight. We got it correct. We got a lottery ticket in and we increased our odds. And then it gives us some rationale about weight management and diabetes. So that was just today's card. It was random. And people are playing to climb the leaderboard. So this leaderboard is going up. I'm in 9th place. I have a 1 in 30 chance of odds of winning. And here's some of our other players in the top 10. I'm going to close that out and just kind of quickly show you the other things on here. But we have weekly workouts with polling and hot topics recommended. We have recommended to you based on your attributes, games that you can play. And then you can even try your luck every day and spin the wheel and try to get free points or double your points in going into a game. So I'll go ahead and spin the wheel one time. I got 3,000 points. I'm happy. I got another ticket into the lottery, increasing my odds. So this is a hot topics area. And again, I don't have time to go in this, but this is loaded with hundreds of topics, active shooters, be smart about narcotic pain relievers. So there's a lot of information that is available through this platform on 82 different topics of how to navigate the healthcare system. So real quickly, these are testimonials and feedback we get. I love the platform. Would rather be on HeadLogix than Facebook at night. That's probably one of my favorite quotes that we've gotten. But we also have testimonials, how this individual from Town Bank has gone to the platform many times to check on the medical conditions and answer questions about herself and her family. So this is a great way. If you have a daughter with diabetes or a grandfather in the family that suffered a stroke, you can get all the information you need on that. It's credible, it's reliable, and trustworthy. So with that, I'm going to turn the program over to a friend and colleague who's one of the most influential guys in Hampton Roads, Jim Spoor, who's the president and CEO of Reinvent Hampton Roads. Jim.
Hey, Tom, thank you so much for inviting me to be part of this. And I'll just quickly try and bring it to ground in terms of why an economic development organization like Reinvent Hampton Roads would be interested in healthier Hampton Roads. And it's pretty straightforward and very obvious, and something that the vision, as you and Tommy have outlined, makes so much sense to us. So we're totally bought into what you're trying to do in your vision, and we really want to be part of it. A little bit of quick background on Reinvent. We were formed about almost 4 years ago now. Hard to believe, but what we found was that our region was lagging in terms of economic recovery from the Great Recession. We weren't coming back as quickly as many of the folks in the region wanted, and certainly as we compared to other regions. So we set out to try and develop a system that could fundamentally alter the region's economic profile and performance over a period of time. And we're a nonprofit organization. We're funded by the organizations listed there, very graciously supporting the work that we're trying to do. But essentially our mission is simple, and it's fundamentally to create and grow more higher paying jobs. And that's coming up there right now. The approach is pretty straightforward as well. We want to be as comprehensive as possible. We view the region, and any region really, as a system of systems. And that's one of the things that got me thinking about health and healthier Hampton Roads. How can we make this region healthier, more productive, and more prosperous? And I was amazed to learn about HeadLogix right here in the city that I managed for nearly 25 years. So we really go about our mission by an approach that partners with others. And Tom has listed all of the organizations that we're reaching out to and trying to involve in this vision and this mission. And we really want to focus on some actionable solutions. So I think these kinds of approaches really apply to any region around the country that's trying to do some of this good work. This model we actually got from Brookings Institution. We've done a lot of work with them in terms of informing our work. And they, I think for the purposes of today and the brief amount of time that I've got, we really want to focus on workforce and talent and business attraction. The old model of economic development was simply trying to get people to move into the region, We're now focusing on talent development, workforce development, and if we have a healthy, productive workforce, we're going to be successful in attracting businesses. So, final analysis, it is all about workforce. Every economic development professional, every economist that I know of has really talked about the fact that it's all about workforce, and that's multidimensional in terms of quantity, availability, the quality of the workforce, what skills do they have, how productive are they. And when you start talking about productivity and availability and quantity, that drives you to health. So the health of the workforce is going to directly impact the availability, the quantity, and the productivity of the workforce. If folks are not healthy, they're not going to be available to work. So that's one of the key assumptions that we're operating on, and we believe that this Healthier Hampton Roads has a lot of merit in terms of addressing those workforce issues. We did some survey work, and we found out that there is a direct connection between business, economic development, and health. 79% of businesses cite a healthy workforce as a key factor in guiding locational choices for new facilities. That was surprising to me, number one, that they would be concerned about the health of the workforce. 98% responded that knowledge of an at-risk population would really prevent them from building or expanding in an area. And we, as Tom showed you on that map of Virginia as an example, we have some pockets of very marginal health literacy and conditions throughout the region. We want to address those so that we are attractive to businesses. He also had a chart that showed that an unhealthy employee costs the company 3 times as much as a healthy employee. So if you're an employer with 100 employees, that's a significant amount of money and impact on your bottom line. So a health and healthy employees really returns an economic benefit. And then finally, only 3% of the federal health budget is spent on public health measures. Local municipalities must carry the weight. So I think the key point there is that we have got to do everything as a region and as localities to try and increase the health of our local workforce. And because if we don't, we're going to have to bear that burden. When I was a city manager, we ran the EMS system, we ran the social service nutrition programs, we ran the mental health program. Those costs were really escalating, and we can't expect the federal government to help. So it's important that we address those issues. We spent some time talking about how do we really stack up. We talked to a lot of folks in developing this regional initiative here in Hampton Roads, and a lot of interest in it, a lot of buy-in in terms of the vision, and we really are about promoting the social and economic benefits of living in a healthy and productive community. We want to be known for that, and we think if we are, we will be successful. And there's a number of components that are really in the system that we're trying to launch here in terms of Healthier Hampton Roads, and they were listed there on the screen. So the aspiration or the vision is that we really provide the opportunity for every resident of this region to live a healthy life and have healthy food, quality housing choices, programs of service that maintain and improve their well-being. If we do that, we're going to be successful as individuals, as a community, and economically. So I think that's really a great vision. When we look at the health of our region, and this is probably similar in almost every region around the country, but what we heard was that we've got mental health issues that are growing. We've got substance abuse issues with the opioid epidemic, and we've got chronic disease issues such as heart disease, diabetes, high blood pressure, and so on. That constellation of issues really need to be addressed and can be impacted tremendously by increasing health literacy. So, healthy communities equal a healthy region, and I think healthy individuals equal healthy communities and equal a healthy region. So that by improving health literacy in Hampton Roads, we can really impact the personal quality of life, and that can be a big game changer for us in terms of the economic development game. So the mission here is to try and work together. We're really a key part of this, at least I hope we're key, and trying to bring a lot of people together and become known over time as a healthy region. And it's important to set up the system to accomplish that and to include everybody, and if we do, it's going to be a classic win-win for Hampton Roads. And hopefully a model that we can export around the country.
Great. Well, Jim, we appreciate you participating and sharing your insight into what Reinvent Hampton Roads is doing and a number of the other organizations that you're part of. So exciting stuff, and we're really critical. It's a critical relationship that Jim and his colleagues bring to the table. Healthier Hampton Roads, just kind of shifting a little bit into the initiative itself. We talked about the interactive digital health platform, and I quickly showed you some of that, the community partnerships. But what about marketing and promotion? How do we market this, and how do we get this out? And it starts with our community partners. All of our community partners are out there talking about Healthier Hampton Roads. It's not too many days go by that I don't get a phone call talking about what they heard about. So we're getting it out there with our community partners. We're making local presentations. We're in some of the local publications with different Inside Business and other organizations. The publication that ODU put out about the forum. But Virginia Business Magazine, which is a statewide magazine, is a key partner of ours that's going to be promoting what we're doing in Healthier Hampton Roads. But social media campaigns and word of mouth are very effective. Word of mouth is probably the most effective. It's a viral type of movement that's going on, and we'll talk about how we can create a movement with good word of mouth and good social media campaigns. But all of these together really help promote the awareness of what we're doing in the community. And faith-based organizations play a key role. I've talked to many of those organizations where they actually bring it out to their members, and then it gets into the home through the actual church members. The local sponsorships of community events is obviously a key part of what we're doing. And then the charitable organizations, we're real excited about the charities. Every community has charitable organizations that have to be integrated into this. And this is an example of a new capability on the platform. When you onboard, you choose your charity. So your points, you're playing for yourself to win cash rewards, to win coupons, to win discounts, to win free Uber minutes, to win, an automobile maybe. Different people in the community we're working with to have incentives and prizes that come from the community members themselves. But as we play on here, as I'm onboarding, I might pick the YMCA of Southampton Roads or Toby's Dream Foundation. These are local charities, the Her Shelter, or it could be national as well. But these are all charities that people can match their points, and these charities are playing against each other on a leaderboard. So you can see here that Rock Solid Foundation is in the lead, and it lists all the people that selected Rock Solid Foundation and are playing for them. So every quarter, and this goes every quarter, there can be a $3,000 to the first place, $2,000 to second, or $1,000 or even more. That money comes from the philanthropists, from the corporate donors, and the way that we're raising our money. So people are playing for charities. Those charities are giving us content. They're promoting awareness, getting their members to sign up and select their charity because they can win from this. And we can promote all the great things that those charities are doing on our website. Operational support, data analytics, and then R&D and continuous quality improvement. Every initiative either survives by having good data and being able to measure metrics around the success metrics that we've established at the beginning. But if you don't have that capability, it's very difficult to be successful. So our data analytics allows us to show improvements in knowledge, for example. This is a baseline knowledge assessment. So people go on, they do a baseline assessment. We look at their understanding of diabetes or asthma or any of these topics, how to navigate the healthcare system and understand insurance is a good one. The seventh one down, we had 25% of the people failed that, and another 30% had D's on baseline. And this is what happens. The greens are A's. So we had really low knowledge at baseline, and after they went through our learning modules, watched videos, played games, and learned, we had significant improvement. We can also look at this from a numeric standpoint. In the middle column here is employee confidence. And so employee confidence is how much more confident are they in understanding heart failure or high blood pressure. And then we actually have documented knowledge improvement. You can see that most people in health insurance, we had almost an F, 61 on baseline in the middle, and went up to a 98, a 60.7% increase. Same thing on understanding gastroesophageal reflux disease, which is heartburn, or we look at low back pain. So most of these people went from D's to A's, high A's, after they went through the training modules. And then what our vision is for the future is once we get this in the community, and this is free of charge, supported by philanthropy, and we'll talk a little bit about raising capital for this, but once we get our platform out there, we can collect information from people that no one else has access to. We can understand the needs of the community and what's going on in their world, so we can design programs that are going to meet those needs. And we can coordinate. Jim talked about the regions. So we have seven city region in this area, but we can coordinate Virginia Beach, Norfolk, Newport News, Chesapeake, all doing the same thing, and Suffolk, all doing the same mental health advocacy program. Or we can have a monthly, or, for the month of January and February, we're going to focus on opioid and substance abuse education. And all the public health and all the healthy Chesapeakes and healthy Virginia Beaches and Suffolks are all working together on common missions through the platform. And we can do the same thing with diabetes, which is running rampant in our area. And we can measure on these dashboards improvements in outcomes and how we compare to the rest of the state. So we can do some really advanced applications that coordinate around specific initiatives. And then we, when we're looking at what the key attributes are for a successful model, talked a little bit about how we plan this and how we're launching it, but we need to have support and broad engagement of all stakeholders. And we talked about all those stakeholders, from employers and municipalities, community organizations, health systems, the economic development groups, and the citizens themselves. We need multi-pronged approaches that are sustained over several years. And we need to have effective use of the volunteers, what Stephanie Gorham is doing, and the social media capabilities that we can employ to create a movement, as I talked about earlier. The use of incentives to maximize engagement, there's got to be a what's in it for them. So they win money, they win cash rewards, they win incentives of a variety of types that to engage in the platform. The more they engage, the higher their odds of winning in a random lottery at the end of every 2 weeks. And we have to have clear and specific goals and the ability to measure progress against those goals. We chatted about that a little bit, but we can go in and really look at what we're trying to do in those underserved communities, that some of those zip codes that have low health literacy, we can go in there and really build programs based upon those and look at the success of how we're actually increasing health literacy and knowledge in other areas. And then adequate funding to support the program deliverables, the incentives, and the long-term infrastructure investments that are needed to pull this off for the long term. So funding is critical, and the way to get funding is we partnered with a Nashville-based 501c3 called the Global Action Platform, a very an international organization. We're raising money through this 501c3. They're also instrumental in what we're doing with Vanderbilt University and the city of Nashville. That's why they're the number 2 right after Hampton Roads. But we're working with them to collect gifts from corporate donors. So corporations, philanthropists, there's a lot of people that are in the community that are looking for ways to help the citizens of Suffolk or the citizens of Norfolk. So philanthropists play a key role, and we have a number of them in Hampton Roads, and they're in every city. We've been starting to talk to them in Nashville as well. So the big corporations have a corporate responsibility to invest into the communities. Centera just announced a $50 million investment into LISC, which is Maurice Jones's operation, to go into those underserved communities in Hampton Roads. And they've combined a $50 million coming up with another 50, gives $100 million to serve and address those social and behavioral determinants of health. But there's national foundations, there's foundations right here in Hampton Roads, the Hampton Roads Community Foundation, and a number of others in all these different cities. But national associations like HERO and the Robert Woods Johnson Foundation is another group. But state and federal support and Medicaid expansion, if we can improve health literacy and reduce healthcare costs and improve outcomes, because we're making these people in Medicaid or these underinsured individuals smarter, making better healthcare decisions, there will be funding from the state from the local and also from Medicaid expansion. And there's actually a bill that's going out called the Child Act, Community Health Improvement Leadership and Development Act. It's HR 660 that's being circulated and is legislation right now and trying to pass a bill that actually gives 70% of the savings of a community back to the community, back to the individuals, not just to the physicians or the healthcare systems. So we think that there's plenty of opportunity. There's major resources out there. There's more money out there to build healthy communities and focus on health literacy than there are capabilities to deliver that. And then just kind of wrapping up, the benefits to Hampton Roads are obvious. We talked about these. The health of our citizens is first and foremost. And it's not just the underserved communities. It's the middle class. It's the wealthy. Everyone struggles with how to manage their health, their family members' health, whether it's prevention, wellness, dealing with chronic conditions. All of that will lead to decreased healthcare costs. Employers that are self-insured need smarter people making better decisions because they're responsible for every one of those claims. Workforce productivity that we talked about with Jim Spoor, it's critical to attract businesses or to allow businesses to expand. And even building this innovation hub with academia, with Old Dominion University and the other universities, it has emerging employment opportunities, and everyone wins from an economic prosperity perspective in the region. We talked about regional alignment opportunities. And then in the region, it gives us a chance to give recognition to what Hampton Roads is doing to attract new companies to come here, to expand into this region. And we've got new companies that are coming here. We're no longer just a government area in Southampton Roads and the military. We're really looking at a number of other areas. So last slide here is benefits to Hampton Roads. Again, at the individual level and at the corporate level, a healthier person that from better lifestyle choices, from programs like we're talking about, becomes a better employee. They have better job performance, and the organization wins. So when you're looking at corporations that are employing most of the people in the region, we have better productivity. Absenteeism is less, better presenteeism. They're not worried about understanding their daughter's diabetes or their mom's Alzheimer's disease because they're more present, because they have a much better understanding of managing those disease states through this platform that's free to them and is able to incentivize them to make better choices as far as learning and better choices as far as their healthcare services, and take advantage of all the programs and services that are available in the community, which the EdLogix platform can actually promote awareness. One of the biggest things, and Centera said, Jordan Asher said, Tom, you're not really a health literacy platform. You're a consumer engagement and communication platform. And we can communicate anything to the community. And there's so many great things, but you got to go find them. You have to go to a website. We push information out through email, through text, and through this app. So with that, I'm going to just pause. We're right at the top of the hour. I want to respect everyone's time. We will take any chat questions from the audience. But again, it was hard to predict how much time we were going to need, but hopefully you gained some insight from some of the comments that I made, that Jim made, that Tom made, or comments from Amanda Jackson from the library system. We hope that you'll reach out to us and get engaged in what you're doing. We as Tommy said, we want to export this. Jim too, export this to other areas. So hopefully you gain some insight into the way that we can prepare, to plan on this, how we're going to launch it, and where we see the future going on this. We're going to be doing quarterly webinars showing the data that we're capturing and the progress that we're making. So we're going to be sending information out to this group so that you can track the progress that Healthier Hampton Roads is making. So again, I'd like to thank you for taking time out of your busy day and our speakers today. And I'm going to go ahead and close this out. I apologize that we ran out of time for Q&A, but we'll get any chat questions that came across. We'll get those out to everyone along with a copy of this digital recording. So any feedback you have, any questions you have, please reach out to us. Thank you very much and have a great afternoon.